Learning how to deal with angry patient or relative is a crucial skill for every doctor. When was the last time you encountered an angry patient or relative? You didn't know how to manage the anger, not knowing what to do or say. It didn't go well. You felt bad for days. Dealing with angry patient is a scenario most doctors find challenging. The problem is, many doctors are not taught how to deal with an emotionally charged patient. It's a natural tendency to feel we are being attacked and become defensive. If you're new to this channel, hi, my name is Dr. Erwin. I help high performers create habits to lead a happy and successful life. I publish new video every Thursday on the subject of happiness and success. If you don't want to miss any future video, don't forget to subscribe and ring the bell. In this video, we'll cover some strategies you can use to deal with an angry patient or relative. Let's take a look at anger. What is anger? Anger is an intense emotional response or antagonism towards someone or something, usually combined with an urge to harm. If a patient or relative has become angry, there's generally an underlying reason. There's a variety of reasons why patients or relatives may become angry. If a patient has been waiting for a long time before seeing a doctor, he may become angry. If there's been an error in the treatment or diagnosis, that could be another reason. Or if the patient just received bad news. Or it could be something financial or social that's happening in their life. You might feel the anger is being directed at you because you're present when you're seeing the patient. However, it's important that you don't take it personally. It is important to recognize the anger at the start of a consultation. Angry patients present in two ways. The first one is a loud patient who's oversensitive to what is being said, maybe frowning at you or using abusive language or swearing at you. This is easily identified. Then you have angry patients who are more quiet and show subtle signs. Once you have identified the patient is angry, make sure that your body language is adjusted to deal with that angry patient. Give the patient plenty of space so that you don't cause more tension in the consultation. The key is to identify early signs of anger so you can address it before it gets out of hand. If a patient is standing and you're sat down, invite the patient to take a seat so that both of you are at eye level. Make sure that your tone of voice is calm and collected. You don't want to talk loudly to an angry patient and try to match their tone of voice. Otherwise, things may escalate quickly. It is helpful to point out to the patient how they come across. So you could say, "I can see you look very upset, Mr. Smith." Recognizing the patient's anger allows you to start addressing the problem. The patient may correct you, "I'm not upset, I'm frustrated." Or the patient may agree, "Absolutely, of course I am." It's important that you remain in control of the consultation and don't let the patient to intimidate you. So set clear boundaries and be assertive when you communicate with your patient. Be firm when you speak with the patient and show respect to the patient. Encourage the angry patient or relative to share their concerns, as there's a strong feeling that needs to come out. The angry patient or relative needs to feel listened and understood. Listening actively to what the patient has to say is likely to diffuse the tension and de-escalate the situation. You could ask open questions to understand the anger. "Tell me more, Mr. Smith. What's causing you to be upset?" After you've asked your question, listen actively to what the patient is saying to you. Avoid interrupting them. Give the patient plenty of time and space to vent their anger. If you sense that the patient is getting more annoyed by the question, you could signpost before asking your question, "Mr. Smith, I know you've been patient and I need to ask you a few more questions to help understand what's been going on." Once the patient or relative has vented their feeling, validate the patient's or relative belief. So you could say, "It is completely understandable you feel that way, given what you have gone through." The next step is to apologize. However, be careful how you apologize. If you or the medical team are not at fault, you could apologize for an unfortunate event. "I'm so sorry that you're feeling angry about what has happened." The key is to genuinely sympathize with your patient. Let me give you a working example. We've got Dr. A and Dr. B. Dr. A sympathizes with the patient and says, "I'm sorry this has happened to you." Dr. B says, "I'm sorry this has happened to you." Both of them said the same exact phrase. However, which doctor is congruent? I'm sure you will have picked up that Dr. B means what he says, whereas Dr. A is saying this phrase just for the sake of saying "I'm sorry." When you're congruent with your words, the patient senses that you care for them and they're more likely to trust you in your management. If a medical error has occurred, be honest and apologize to the patient and explain this is taken seriously and will be investigated to ensure things like this do not happen in the future. The aim is to demonstrate empathy and let the patient know you understand them, that you're both on the same page and that you're going to work through this together to help the patient. Encourage solution to the problem. Ask the patient or relative, "What would you like me to do to help you?" By asking such questions, you show you care enough about the situation. You show a willingness to help rectify it. Be careful what the patient or relative may request and make sure that you set your boundaries. If you can't give the patient or relative what they're asking for, let them know that you have a dilemma here and propose them something alternative that might help them. Once you have discussed with the patient or relative how you could help them, thank the patient or relative for sharing their personal feeling and let them know how important it is for you to know how they're feeling and how you can help them. Make sure that you formulate a clear plan of actions going forward to help acknowledge the patient's anger. Occasionally, even if you're using these strategies, you might find yourself with an angry patient who is becoming more aggressive and more angry, and you find that the situation may escalate with the emotion going out of control, escalating to a rage. So in this situation, it's very important that you evaluate your safety, and if you feel that you are possibly going to be threatened, you should remove yourself from the situation and prioritize your own safety. Last but not least, when you're managing an angry patient, make sure that you stay professional and calm. Don't use anger to deal with anger. Show that you're empathetic, that you care for the patient, and make sure that you align the patient's goal with yours to help them work through this situation. I'd love to hear how you deal with an angry patient. Write down in the comment section how you dealt with the last angry patient you saw. Let me know what's your takeaway from this video. Write down in the comment section what's your takeaway. Thank you for watching this video till the end. If you've not already subscribed to this channel, don't forget to subscribe and hit the bell to be notified for future videos. I hope you find this video useful. Take care everybody. Bye bye.